I will be sharing a little bit of an update on the project that we had previously presented last semester. So if anyone needs to take a break to grab a little bit of extra water, lemonade, refresh yourself with any of the food we have here, please feel free to do so. Likewise, for our wonderful audience joining on Zoom, please feel free to take a step away as we come back. We'll use this transition to also introduce our colleagues and collaborators from across campus, our collaborators from our School of Computing and Information, and our library science program will be taking on the next presentation as I wrap up our update. Last semester, we had presented on a project to better characterize how our clinicians, broadly termed for both pharmacists, prescribers, but also any practicing nurse, occupational therapists, physical therapists, etc., capture social determinants of health, information about our patients related to transportation, housing, employment, the multitude of factors that create the majority of our lives that can influence health that may not be directly captured in something like an electronic health record. So we are very fortunate to work with the team, not only myself, but Tim Huang, who will be presenting here in just a moment, but also our own faculty with Sharon Connor and our P3 Jocelyn Schmersel, who is able to take the information that we had presented in our protocol last semester and create, from the results, a qualitative analysis poster that she had then presented at the Health Disparities and Social Justice Poster Competition. Some of the takeaways from these interviews conducted across 3 primary care settings across Pittsburgh were characterizing how the relationship of the clinical practice site, if it was mainly dealing with populations that might be uninsured, might affect the relationship between the clinician and their interaction with the electronic health records or various systems at their clinical site. Other takeaways included things like perspectives of learners or the challenge of recognizing if there is a section within our electronic health record, a little tab, if you can imagine, that says SDOH on it. When does anyone click on that out of the 500 other boxes or areas that you can click on within the EHR? So where is the intuition, the design, or lack thereof in these relationships? And so we are very excited to have folks like Jocelyn and my colleague Tim Huang will invite up here as we turn things over to his library science students here in just a moment. Our takeaway is we're hoping to build on these experiences as case studies as we look to characterize the clinician experience. We hope to better characterize our patient experiences as well. So our IRB approved and currently live survey is going out to patients to ask about where and when do they get asked about questions related to access to transportation, concerns about housing and food security, etc. Who's doing the asking and what preferences do they have? Hopefully we can find some of the reconciliations or misalignments between what we see in clinical workflow and what patient preferences might include. So I'm excited to continue that work and appreciate the chance to share this update from last semester. As I turn things over to our library science students, I'll ask Tim Huang to come up just to be ready whenever after they're done, and I'll pause to ask for a quick AD check on the part of our students. Are you able to share